So my name is Claire Christian. For some of you that do know me and some of you that don't know me, I have been in post since the end of November last year, and it has been, as I can honestly tell you, the quickest 10 months of my life has flashed by, but it has been probably one of the most amazing times. I can also say, hand on heart, it's a true privilege not only to be a member of the House of Keys, but it is a true privilege to be in an organisation that delivers healthcare and working with such wonderful health professionals. I'm not sure if there's any here today, but I know we all want to thank them for the work that they do, and it really is critical, and I cannot thank them more enough for that. So thank you, James, for that, also for that wonderful introduction. We're here today really not just to talk about obviously healthcare and social care, but also we're here hopefully to help shape that future together. So with that said, what we're going to cover today is obviously our priorities. So something that is very paramount for everybody sat here today is obviously our budget and how we allocate that budget and how we cost and pay for our services, which is incredibly important. So it's aligning our healthcare needs and our costs and our capacity, and balancing that, obviously, our healthcare needs with the fiscal reality. We're also going to be touching on the DHSC governance review, which is something which we introduced when I first became minister. That's something that is exceptionally important looking back. So since Manx Care has been in its inception of 4 years, it's looking back at that and seeing what can we do better, how can we get the, as far as I'm concerned, the trust and the public confidence in what we're doing, and that it's the right time to be doing that before we're just going into the next administration. We're also going to be discussing things that are really important, I know, to everybody sat here today. The access to primary care services, whether that be GPs, whether that be dental services. And also, which is something that's incredibly important, is sustaining our healthcare system, which means that we really need to put our healthcare back into the community to take less pressure off our acute services. And of course, without everybody who knows me, obviously mental health is something that's a real great passion of mine, and looking after the health and well-being of those around us. So balancing healthcare and cost isn't a compromise. It is a commitment to a smarter and fairer healthcare. But what we're going to do just this afternoon is we're going to check your temperature. So I wanted to have something a little bit interactive today, because I think it's really important that we do value what you and your opinions are, especially after something that we're going to do, obviously the debate. So I'm just going to show you here. So if you've got a phone with you today, a smartphone, if you basically take your camera onto the, what's it called, the QR code, that's it. We're going to start asking you, there's just 4 simple questions. And we'll ask very similar questions towards the end of our presentation today, just to gauge whether what your feelings are at the beginning and what your feelings are towards the end. And I think this is a really good way to understand there's such a large group of you here today, and we want to know that what we're doing, we're heading in the right direction. Are we effective? So I hope if you could we're going to start doing this now, and you can see the score there. Fantastic. I'll give you another minute. It's quite interesting watching it going up and down. So yeah, the first question is, how confident are you that Manx Care and the Department of Health and Social Care are balancing care needs with fiscal reality and efficiency targets? So it's good to ask that question before we start. Okay, I'm going to move on to the next question if I can see some people still at the beginning. Okay, the next question is, how confident are you that you can access GP, dental and mental health services when needed? Chief Minister, I can't believe you're not doing this. I think, to get that trust in me. Okay, moving on to the third question. To what extent do you feel local health and care services, locality hubs, shared care and community appointments are meeting the needs of your community? Obviously, what happens is it, as more people start to enter the answers, it shifts. Okay, I'm moving on. Last question. Based on the last time you saw a health or social care worker provided by the Isle of Man NHS, how well do you feel they listened to your health or social care concerns? Okay, so we'll come back to those questions at the end of the panel questions, but thank you for that. So what we're going to move on to now is we're going to talk about the budget. And obviously, the most important thing is obviously the efficient and effective and economical operation that we're looking at here. We're responsible for the management of 361 million revenue budget, including a 2% efficiency target for value. And most of you will know that actually our cost improvement programme is actually about 4%, whereas in other jurisdictions it's normally about 2%. So we have got quite a difficult task. But every pound must serve a purpose, and that purpose is obviously better health outcomes. So looking at working together is obviously one of our priorities. You can see that today we're sitting with Manx Care, and that was one of the really important things when I stepped into this position, that we really strengthened that relationship with our partners. Obviously, it's important to listen to each other and to listen to what you're saying. So it's really important that not just aligning our mandate and our operating plan, but also our financial budget is really, really important. So we started working together on a 3-year financial sustainability programme. And that stability without affecting our future services. So we're looking at controlling and planning and delivery and transformation as well. So the financial sustainability programme is the cornerstone of our approach, and it's a 9.8 million in potential savings identified so far for this year, and with 3.6 million we've already achieved this year. And this isn't about austerity, this is about transforming about how we deliver care. Obviously, we want to balance efficiency with empathy. So every service area carries a 2% efficiency target, but we're not asking teams to do more with less. We're asking them to do better with what they have. And this is supported through digital innovation and workforce planning, and obviously smarter care of models. So the DHSC, obviously, this is how it works. I think it's quite interesting. So from the DHSC's point of view, we receive the Treasury funding, and Manx Care and the department work on allocating that based on service specifications. The most important thing here is obviously we're looking at the financial sustainability programme, which is obviously, as I said, in progress, and we're focusing on 7 work streams, including financial control, and that's really important, I think, for everybody sat here today, getting rigour and robustness around that financial control, including and working with in terms of the demand, and then also demand management, productivity, IT, and digital enablers. So I talked a little bit about the governance review at the beginning. Why is this important? And it is exceptionally important because Manx Care, the inception of Manx Care came about 4 years ago. This was new legislation, and it's important that we relook at that legislation and make sure that that's fit for purpose. We've appointed the MIAA to do the governance review, and they've actually been doing reviews on the DHSE, who provided the services since, I think it was about 2014. So they've got quite a good history in terms of how the healthcare systems have developed over the years. And the importance of this governance review is to obviously to gain public trust. And I think that is essential. Hopefully, we'll be able to gauge that for later on today. So, there are 4 lines of inquiry in the governance review: efficiency, governance, and efficacy, and accountability. The draft response, so obviously we started this in October 2024, when we asked the department the department was asked to review the laws and the governance related to Manx Care. The draft report will go out this week to the department, so we're already well ahead of this, and then obviously it will be coming to the Council of Ministers in Tynwald shortly. Moving on now. So I'm going to hand over to Teresa, who is basically going to give a little bit more detail in terms of what we're doing in terms of primary care and dental waiting lists, and also our care in the community. Thank you. Do you want me to?
Thank you. Thank you, Minister. Good afternoon, everybody. And thank you for giving us the opportunity to just speak about some of the initiatives that are happening across Manx Care, which enables us to really put care in the right place with the right people at the right time and support care closer in our communities. So we know that access in primary care has been top of everyone's agenda. It's heavily referenced in the mandate, and we're keen to make sure that we make incremental strides to improving access into primary care. This is not just about access to a GP. There are a wide range of professionals who work in primary care, and it's about increasing the access to those individuals too. About 60% of the primary care appointments on Ireland are delivered by GPs, and 40% are delivered by a range of other professions with specialist interests and the skills and expertise in order to manage patients in their communities. So what we know is around a third of patients are able to access appointments the same day. There is a wait time of around 8.2 days in order to get a GP appointment, and we know that's a cause for concern, and we're committed to reducing that. We are committed to putting more capacity into primary care to make sure timely appointments can happen, and that we use that capacity effectively. So around 345 appointments per 1,000 people, compared to a slightly higher number in the previous years. What we have seen in primary care, in support of more complex care management in the community, is the appointment time has increased from 10 minutes to 15 minutes in many practices. And that is to improve the patient experience, to provide more holistic care, but is also referencing that many of our GP practices are training other professionals within their practice. So more time is needed. And what are we doing? Well, we've had first contact practitioners. These are expert practitioners in both mental health services and physiotherapy, and they are now starting to deliver more and more appointments out in the community. At the start of this year, we launched a virtual GP pilot up in the north of the island, working with Ramsay Group Practice. Virtual GP is one of the options we have available to us, which is a way of increasing capacity. And virtual GP is providing 400 appointments per month in the north of the island. High acceptance rates. We're using 95% of those slots, and a really low DNA rate, which is really, really encouraging to see. We will see and evaluate the impact of what that does and how that virtual GP pilot really works. What we're seeing is about 8% of those virtual GP appointments translating through to requiring a face-to-face appointments. So 92% of people being seen by virtual GP are actually having their condition managed through that virtual appointment. A really important development, never a replacement for face-to-face consultations, but something else that we can look innovatively at delivering that extra capacity. Pharmacy First is a really important project, which gives us the opportunity to use our pharmacist skills across the island in a different way, for them to be offering appointments and that capacity. And so we're really excited to think about Pharmacy First launching and offering that opportunity to our community pharmacists across the island. And working with our GPs to transfer care out of the hospital and look at more shared care arrangements where hospital consultants and GPs work closely together to provide care and monitoring of those patients, but remaining in the community where they may have previously had to come into hospital for that care. So some really important developments. The August data is already showing that this is all having an impact, and it's slightly improving the access times for primary care, but it's something we are absolutely committed to doing. So moving on to dental waiting lists, and you will have seen this in the media. We absolutely want to make sure that we are providing comprehensive dental care for everyone in the island. And you will know that the dental waiting list has been a significant cause for concern, has been increasing since COVID. And just before we announced these interventions, we had just over 6,000 patients waiting to be allocated to an NHS dentist. And 30% of those were children. Now, we all can agree that's unacceptable and something we wanted to tackle. So we have invested in this and increased the value of dental activity to ensure that our dental contractors accept this new way of working. We're really grateful to their cooperation. They have co-produced this solution with us. And this means that this new contract means that the vast majority of those waiting for a dentist will be allocated, and we will see that waiting list eliminated by the end of this financial year. It is a big ask, but the new contracts will enable that to happen. We're also in the procurement process to replace the Grove Mount surgery up in Ramsey. And we have actually put 900 extra patients into that procurement process, increasing the capacity of dental activity being delivered in the north of the island. And Hillside Dental Practice, which Manx Care took over a couple of years ago, is also providing some additional activity. So having had a very difficult position of high numbers on the waiting list, we are now starting to see that. The last month's activity showed that number had reduced under the 6,000 banner. So we should see 1,000 off that list as we go through the rest of the financial year. Locality hubs are really important. We already have hubs across the island, and we've had those for a couple of years. But we are focused on making sure they are truly holistic and they have the wide range of professions within those hubs so we can support timely early intervention, the right care. We are decentralising some of our functions in social care, in therapies, and putting that capacity wrapped around our GP practices into our locality hubs. It's a really important development because this supports care closer to home, the home first model that you will have heard us talk about in our annual plan and in the mandate. The Ramsey hub is trailblazing this. It's helpful because we have a single GP practice up in the north, but absolutely fully committed colleagues up in Ramsey Group Practice, working really closely with Manx Care, working with the voluntary and community sector partners up in the north, and really offering something quite special. And if any of you went to the Nice Up North event a couple of weeks ago, you will have felt the level of connection, cohesion, and just the amount of people working closely together in the best interests of their community. It was quite special to be part of that. We also deployed the first contact practitioners and were committed to rolling out these hub developments. Mental health services, it's so important we get this right, and there won't be anybody in the room who disagrees with that. We must make sure we have strong evidence-based practice, that it's timely and it's appropriate. And we have been incredibly fortunate to have some additional investment to support our child and adolescent mental health services, which had a very, very significant increase. This is global. It's not just an Isle of Man issue. And we saw increased numbers of referrals into both adult and children's mental health services after the pandemic. But we're making strong inroads into reducing those waiting times. The waiting list has over halved since we started this initiative at the back end of last year, and we've always had a really strong collaboration with Our Listen, and we are working in close partnership with Our Listen. They lead our talk service, which is a single point of access and allows self-referral. And we are starting to see many, many people being able to receive their care by Our Listen and the talk service with a really prompt time from assessment and treatment, which you can see there. This will transform how we do things here on the island. It allows us to move to early intervention. It allows us to do the Thrive model, which we know is evidence-based and work. It's about timely interventions, supporting schools, supporting people early, and we recognise we still have a long way to go, but we are on the right trajectory. And the Community Wellbeing Service, this is our psychological therapies, and we have seen that expand significantly in the last 4 years. And again, talking therapies, really, really important. And again, we have strived to achieve really good waiting times with 86% of individuals seen within 18 weeks, and we are aiming for 75% of people seen within 6 weeks within the next 12 months. I want to just fly the flag for dementia. It was Dementia Action Week in May, and the Manx Care Board received presentations and, in conjunction with public health and some of our third sector partners, have undertook comprehensive training across our professionals, but open to everybody. We estimate, very conservatively, there are over 2,000 people on the island with dementia. And it is really important we all understand the very simple changes we can make in communication, in our actions, which really aid people who are living with dementia, and supporting the families and carers who support people with dementia. So there is something called being a dementia friend. So I wanted to give a shout out and a plug for everyone to think about that. There's an event at the Sea Terminal later on this week. It is World Alzheimer's Month, and it is a really, really important initiative that Manx Care is getting behind, because most of the changes and adaptations that we can do to support those with dementia cost absolutely nothing, but make the absolute world of difference. So I'm going to hand back to Minister now just to say a few closing words on strategic direction.
Thank you, Teresa. And I talked a little bit before about how coming into this role, and I just want to draw on just one of the experiences before I talk about the strategic direction, which really kind of crystallises, I think, what Teresa's talked about in terms of the GP services, our dental waiting services and care in the community. I had a member of the community reach out to me when I first became minister. And really, they were really wanted to just explain their situation, or certainly their wife's situation, as a good example. And that example was his wife had had an earache, and she'd been trying desperately for 3 weeks trying to get a GP appointment. And once she eventually got through to her GP, the GP recognised that she needed some urgent help. So basically said, look, you can get, if you phone meds in the evening, you can see your doctor, and you can get some emergency help from that. And this patient did that. They got a prescription, and after a week, the prescription it hadn't really helped, and they ended up in our A&E. And I looked at that case, and I looked at it and I thought, in terms of what I said earlier about value for money and how we spend taxpayers' money. And because we, from my perspective, hadn't had that early intervention and that early point of contact, had we been able to see that member of the public right at the beginning when they first had that simple earache, we wouldn't have had to pay for it almost 3 times, the GP, the meds, and then obviously in our acute services. And it's simple as that. We've really got to start pushing our budget, which I've talked about before, allocating that budget into our primary care and into our care in the community, so that we get the better results, and we push down the demand in our hospital, which is really, really important. So now, just coming on in terms of our strategic direction. So, early intervention and prevention to support healthy ageing and reduce our inequalities. We also want to empower communities and expand screening and use data to develop long-term strategies. We've got to plan for this, for our future needs. I cannot say how important that is. We need to know what our needs, what you are going to need, what our children are going to need, and what the demand is going to be in 5-10 years' time. We need to stop looking at a budget just year on year, and we need to be looking at forward planning. We need to align the services and our workforce infrastructure to those population needs. We need a better integrated, person-centred care through locality hubs, which is what we spoke about. And also we need the legislative reform and sustainable funding. Safe and appropriate and consistent care across our services is extremely important, and we need to strengthen those care pathways, embed NICE guidelines, and invest in our workforce. And I've mentioned earlier, we need to build public trust through accountability and oversight, and we need to implement government plans and clarify the roles and review the frameworks. So in short, ladies and gentlemen, balancing care needs with fiscal reality means leading with integrity, planning with foresight, and delivering with compassion. It is about building a better future together, where every decision reflects both the needs of our people and the responsibility we hold as stewards of public funds. Thank you.